Thank you for the yielding to me. Mr. Speaker, I've spent 28 years as a physician practicing rural medicine, even serving on the board of my local hospital. I'm well aware of the great financial difficulty most rural hospitals and clinics experience each year. Today, I was pleased that the state of Michigan celebrated Rural Health Day. On behalf of the thousands of Michiganders that call small towns and farming communities home, my state's governor chose to recognize the hospitals and community-based centers that provide for the diverse and unique health care needs of these areas. Tonight, I'd like to join the state of Michigan in raising awareness about the importance these providers bring to the communities that I represent. While we recognize the importance of rural health today, I would be remiss if I did not mention one of the great rural health facilities in my district. Many of my colleagues may have visited the Straits of Mackinac during a summer vacation, or perhaps they've seen the Mackinac Island featured on a Pure Michigan ad. The Rural Health Clinic in St. Ignace is the single largest employer in the community, supporting not only the local township, but in addition, the 900,000 plus seasonal visitors that depend upon the hospital for services each year. I recently received a distressing letter from Mr. Rodney Nelson, the CEO of Mackinac Straits Health System. Mr. Nelson is very worried about the impact Medicare cuts may have on his patients, employees, and ultimately the ability to keep the doors to the hospital open. Mr. Speaker, the Mackinac Straits Health System is one of the 25 hospitals in my district that are considered either critical access or sole community hospitals. Of these, 56% are already operating in the red. Unlike urban areas, my constituents often do not have another option when seeking health care. In the case of the St. Ignace Hospital, the next closest clinic is 50 miles away. What you may not know, Mr. Speaker, is that caring for patients in rural facilities is far more economic than providing urban care. In fact, rural patients cost less to treat in 8 of the 9 CMS regions. As my colleagues and I discuss possible ways to trim the budget, I feel it's important to remember that without rural hospitals, many of my constituents would not have access to medical care. A 2% reduction in Medicare spending is estimated to cost 389 jobs in my district as a direct result to cuts to rural hospitals. If this number were raised to 10%, the figures would only get worse. At that point, 76% of the hospitals would be operating in the red. And the total economic impact is expected to be nearly $68 million, with 1,900 jobs affected. Mr. Speaker, I don't need to tell anyone that people in northern Michigan can't afford to lose another 1,900 jobs. Mr. Speaker, if we force these cuts, not only will we lose these jobs, we will lose access to many people's sole source for health care. We are forcing rural patients to travel longer distances to seek more expensive care. This just costs everyone more money. I urge my colleagues to exercise caution when considering reductions to Medicare programs, especially those specific to physicians, critical access, and sole community hospitals. I yield back my time.